Assalamualaikum doctors. In this video, I am discussing a communication. That is, the task is that 14 years old girl who is recently diagnosed with diabetes mellitus. Okay. So remember, any case of diabetes mellitus, good or bad teenager, we should talk about insulin. Okay, insulin, measuring blood glucose level, exercise, counting carbs, and hypoglycemia. Again, we should talk about insulin, measuring blood glucose level, exercise, carbs count, and hypoglycemia. These are. So first, how can we draw pictures like a pancreas cell, leaf-like organ, cell secret inside the cell, then it causes the function glucose inside the cell. Okay, I'm telling. Hello Alia, hello doctor. I'm Dr. Emma, one of the doctor here. Nice to meet you. Nice to see you. Alia, I am here to talk with you about your health. Would you like anyone to be here? Of course not. I did not mean that. Do you think am I a baby? Need a babysitter? Of course not. I did not mean that. I just want to know if it is a suitable time to start or not. You can start, doctor. Okay, so how much do you know about your health conditions? They told me that I have diabetes and they did not explain me anything for me. Okay, I'm so sorry for that impressions, but let me explain for you. In our tummy, there is a leaf-like organ that is called pancreas. In this pancreas, there are some cells secrete a chemical substance called insulin. And have you heard about it before? Yeah, I know what is the insulin. This is the medicine I take it. Perfect. This insulin acts like a key. It opens the door of the cell to allow the sugar to be used as a fuel. Am I making myself clear? Yes, doctor. And also we have in our body the defense system. It acts like a strong soldier against the germs and bugs. Are you with me? Okay. But in your condition, it doesn't only attack only germs and bugs. It attacks the cells, the pointing the pancreatic cells. The resulting is no insulin, and thus it's why we have to take it from the outside. Okay. So mechanism I am again telling. First of all, we draw a picture. There is a leaf-like organ called pancreas. In pancreas, there are some cells which is a chemical substance we call insulin, which is secrete the cell. This insulin function is what they do. They the glucose in the blood, which they as a key doing inside the cell it put. So our blood glucose level is remain normal. But what happened in diabetes mellitus? Our defense system normally acts against the germs and bugs. But in diabetes mellitus, what happened? This defense system not only against the germs and bugs, it also affect the pancreas and cell. That's why there is no insulin in the body. That's why we give the outside from the insulin. Okay, then the teenager asking, oh, how long? I'm really sorry, Alia. We have to take it for lifelong. Say it with sad voice. Doctor, I cannot take injection for lifelong. My grandma taking tabs. Why I cannot take tabs like here? This is very smart observation, but actually there are different type of diabetes. In your case, as I just mentioned, there is no insulin. That is why we have to take it from outside. But in your grandma condition, she has some insulin, but it does not work properly. Am I clear? So in type 1 diabetes mellitus, actually in the body there is no insulin. That's why they are taking as an injection from outside. And the type 2 diabetes mellitus, actually they have age, they have some insulin, but it's not working properly. That's why they are only taking tabs. Am I okay? Okay, doctor, but 4 shots per day, it is very painful. My school friends gonna make fun of me. I'm sorry for that. I understand your feelings. If you want, we can give you some numbness cream to help you to ease the pain, and also we can liaise with the school nurse. You can go in her office to take your shots there. So pain, we are giving numbness cream and liaise with the school nurse. After a period of time, when we get diabetes under control, then the gland doctor may change the regime from 4 shots a day to 2 shots a day. Okay, then we change with the gland or endocrine doctor. Okay, doctor. Also, Nada, also Alia will have a meeting with the doctor. He will teach you what is good for you and what is bad for you, what is helpful and what is harmful. Are you with me? Okay. It also better to have an active lifestyle. Also, diabetic nurse will teach you how to take the insulin by yourself and how to measure the blood glucose. Am I clear? Okay. Also, it is advisable to wear a bracelet and something sweaty in your bag all the time in case you felt you are really hunger, cold sweats and hand shivering, it is better to take, as that means that you have low blood sugar. Are you with me? So as hypoglycemia advice we are giving that she will be wear a bracelet and something sweety, like sweet type, something like chocolate, biscuit, she will keep all his back all the time, because in any time she becomes so sweating, hunger, cold sweats, hand shivering, it is better to take it as, because there is low blood sugar sign. Yes, but doctor, I have another questions. I'm really worried because my grandma had diabetes and she is losing her eyes. Is this gonna happen to me as well? I really understand your feelings and I'm really sorry for your grandma. Actually, losing eyesight could be one of complications of uncontrolled diabetes. Following up with the team, taking insulin, this may not happen. Also, we'll have frequent follow-up with the eye doctor to pick up any early change in your eye to treat it very, very quickly. Then trusted website, written leaflet, support group. So we understand the diabetes mellitus case. We are telling the pathophysiology. We are telling that it is lifelong injection insulin treatment. We are telling that hypoglycemia features and thinking some sweetie, wearing bracelet advice, diet advice, and active lifestyle, that is exercise. These are the include on the diabetes mellitus communication.